Chapter 11. Reasonable is greater than rational. Aiming to be mostly reasonable works better than trying to be coldly rational. You're not a spreadsheet, you're a person, a screwed up emotional person. It took me a while to figure this out, but once it clicked, I realized it's one of the most important parts of finance. With it comes something that often goes overlooked. Do not aim to be coldly rational when making financial decisions. Aim to just be pretty reasonable. Reasonable is more realistic, and you have a better chance of sticking with it for the long run, which is what matters when managing money. To show you what I mean, let me tell you the story of a guy who tried to cure syphilis with malaria. Julius Wagner Jarek was a 19th century psychiatrist with two unique skills. He was good at recognizing patterns, and what others saw as crazy, he found merely bold. His specialty was patients with severe neurosyphilis, then a fatal diagnosis with no known treatment. He began noticing a pattern. Syphilis patients tended to recover if they had the added misfortune of having prolonged fevers from an unrelated ailment. Wagner Jarek assumed this was due to a hunch that had been around for centuries, but doctors didn't understand well. Fevers play a role in helping the body fight infection, so he jumped into the logical conclusion. In the early 1900s, Wagner Jarek began injecting patients with low-end strains of typhoid, malaria, and smallpox to trigger fevers strong enough to kill off their syphilis. This was as dangerous as it sounds. Some of his patients died from the treatment. He eventually settled on a weak version of malaria since it could be effectively countered with quinine after a few days of bone-rattling fevers. After some tragic trial and error, his experiment worked. Wagner Jarek reported that 6 in 10 syphilis patients treated with malariotherapy recovered, compared to around 3 in 10 patients left alone. He won the Nobel Prize in Medicine in 1927. The organization today notes the main work that concerned Wagner Jarek throughout his work life was the endeavor to cure mental disease by including a fever. Penicillin eventually made malariotherapy for syphilis patients obsolete, thank goodness. But Wagner Jarek is one of the only doctors in history who not only recognized fever's role in fighting infection, but also prescribed it as a treatment. Fevers have always been as feared as they are mysterious. Ancient Romans worshipped Febris, the goddess who protected people from fevers. Amulets were left at temples to placate her, hoping to stave off the next round of shivers. But Wagner Jarek was onto something. Fevers are not accidental nuisances. They do play a role in the body's road to recovery. We now have better, more scientific evidence of fever's usefulness in fighting infection. A 1 degree increase in body temperature has been shown to slow the replication rate of some viruses by a factor of 200. Numerous investigators have identified a better outcome among patients who displayed fever. One NIH paper writes, the Seattle Children's Hospital includes a section on its website to educate parents who may panic at the slightest rise in their child's temperature. Fevers turn on the body's immune system. They help the body fight infection. Normal fevers between 100 and 104 degrees Fahrenheit are good for 6 children. But that's where the science ends and reality takes over. Fever is almost universally seen as a bad thing. They are treated with drugs like Tylenol to reduce them as quickly as they appear. Despite millions of years of evolution as a defense mechanism, no parent, no patient, few doctors, and certainly no drug company views fever as anything but a misfortune that should be eliminated. These views do not match the known science. One study was blunt. Treatment of fever is common in the ICU setting and likely related to standard dogma rather than evidence-based practice. Howard Markle, director of the Center for the History of Medicine, once said of fever phobia, these are cultural practices that spread just as widely as the infections disease that are behind them. Why does this happen? If fevers are beneficial, why do we fight them so universally? I don't think it's complicated. Fevers hurt, and people don't want to hurt. That is it. A doctor's goal is not just to cure disease, it's to cure disease within the confines of what's reasonable and tolerable to the patient. Fevers can have marginal benefits in fighting infection, but they hurt. And I go to the doctor to stop hurting. I don't care about double blind studies when I'm shivering under a blanket. If you have a pill that can make a fever stop, give it to me now. It may be rational to want a fever if you have an infection, but it's not reasonable. That's philosophy. Aiming to be reasonable instead of rational is one more people should consider when making decisions with their money.